Hello everyone. In this session, we are going to discuss RBC indices along with ESR. So basically, I will be discussing 5 RBC indices here. That is MCV, MCH, MCHC, RDW and PCV along with erythrocyte sedimentation rate. Now, although these topics are more important for your practicals, for your viva, but in your theory also very frequently you get short or very short note on any one of them. So let's start the topic. We are starting RBC indices along with erythrocyte sedimentation rate, that is ESR. So let's start it. So first of all, I will let you know about the RBC indices. So we will be starting the details of the RBC indices. We will discuss 5 RBC indices in detail. Their definition, their formula and the conditions in which they increase and decrease. And we will make a comparative table also. So the 5 indices are, the first one is MCV. What's the full form of MCV? It's mean corpuscular volume. That is MCV, mean corpuscular volume. The second is MCH. That is mean corpuscular hemoglobin. MCH, mean corpuscular hemoglobin. The third is the ratio of the two. That is mean corpuscular hemoglobin concentration. You can see MCHC, mean corpuscular hemoglobin concentration. The next is the RDW. That is red cell distribution width. Red cell distribution width, that is RDW. And last one is PCV, that is packed cell volume, also known as hematocrit. So first you learn the 5 type of RBC indices, their full form, and after that we will see the details of erythrocyte sedimentation rate. What's the definition of erythrocyte sedimentation rate? What is its principle? The factors affecting it? What are the phases? The methods by which we measure it, and the diseases in which it increases and decreases. So we will be discussing the ESR under these headings. So let's start it. First, let's start with RBC indices. So let's start with the details of the 5 RBC indices. As I told you, MCV, MCH, MCHC, RDW and PCV one by one. Let's start with MCV. What is MCV? As I told you, learn the full form. The full form of MCV is mean cell or mean corpuscular. Corpuscular or cell is one and the same thing. Mean cell volume or mean corpuscular volume. That is MCV. Now you tell me, this is the blood vessel of a human. In the blood of an adult human being, how many RBCs are present? Can you tell me the number? Yes, it's 4.5 to 5.5 million RBCs are present per mm cube. So this is the normal count of RBC. So you can imagine 4.5 to 5.5 million RBCs are present. Now, if we measure the volume of each of them, all 4.5 to 5.5 million, we measure the volume of each of them. So the total volume upon we divide the total volume with the number of the RBC. So we will get the average volume. What is mean or what is average? So in mathematics, have you read the formula of mean or average? So mean or average. So if I say the volume of the first RBC is V1, the second is V2, the third is V3, V4. So we add all of them, V1 till Vn. Divide by number of RBCs. So that will calculate the average volume of all of them. Some RBCs have more volume, some will have less volume, some have normal volume. So we are taking the average of all. So basically it's the average volume in the human blood. Average volume of what? Average volume of RBCs. So it is the average volume of the RBCs. So if we do so, normal values falls between 82 to 96 femoliters. The unit of measuring is femoliter because it's a volume, we measure it in femoliters. What is the formula? As I told you, now this is the blood. If I am taking the blood in a test tube, this is the blood. Blood contains 3 cells, RBC, WBC, platelet along with plasma. So 4 things are present in blood. So let's centrifuge it. What will happen if you are going to centrifuge it? All the RBCs will settle down at the bottom. And this is known as packed cell volume. RBCs. Now the WBCs and the platelet will form a buffy coat. So this is the buffy coat, and all the plasma will be coming at the uppermost part of the test tube. So whenever we are centrifuging a test tube, a blood in a test tube, so you can see all the RBCs are settling down at the bottom. So basically this portion is representing the average volume of all the RBC. So all the RBC, 4.5 to 5.5 million per mm cube, all the RBCs are settling down here. So it is the average volume. So can I say the average volume of all the RBCs is PCV? So the numerator is the PCV and the denominator is the total RBC count. That is 4.5 to 5.5 million per mm cube. So that is the formula of MCV. What's the formula of mean or average in mathematics? Have you read mathematics? In mathematics, there is a formula of mean or average. So mean or average is the summation of all the values, summation